Hi, my name is Kristen Brooks. I'm a nurse practitioner at Urology San Antonio. Today, I'm going to be talking about a new prostate cancer diagnosis. So you just got a prostate biopsy confirming a prostate cancer. What's next? Where do you go from here? We understand that a new prostate cancer diagnosis or occurrence of your cancer can cause a lot of anxiety and even uncertainty. One of the most important pieces of information to know is that not all prostate cancers are the same, and overall, only 17% of patients diagnosed with prostate cancer actually die from their disease. There are various treatments for newly diagnosed prostate cancer, or for prostate cancer that's returned after treatment, or for advanced disease. Your doctor will work with you and determine the next steps specific in your treatment plan based on your specific cancer. Whether that's active surveillance, starting treatment, we want you to feel confident and comfortable with your next steps. After hearing about your diagnosis, the next step is to determine the level of aggressiveness of these cancer cells. A doctor that interprets these specimens is called a pathologist. They will look at the specimen 2 times and give it a score between 3 and 5 each time. A score of 3 is the least aggressive, while a score of 5 is the most aggressive. The first score represents the most common pattern, while the second time they look at it represents the next most common pattern. They'll combine these numbers and give what's called a Gleason score. This can range from a Gleason 6, or 3 plus 3, all the way to a Gleason 10, or 5 plus 5. Sometimes this can be confusing. So there's another way of interpreting these numbers by giving them a grade grouping score from 1 to 5. Group 1 represents a Gleason 6, while Group 5 represents a Gleason 10. We use these numbers along with your PSA and your initial rectal exam to determine your risk of death from prostate cancer or return of disease after treatment. When determining treatment, we consider your age, overall health, urination symptoms, prior surgeries, erectile function, and treatment interests. At times, we also use diagnostic imaging to aid our decision-making. Your cancer treatment options consist of active surveillance, which is careful following of your prostate cancer, surgical removal, radiation therapy, hormone therapy, or other non-mainstream alternatives.